It's time for Checkup with Dr. G.
Good morning. It's Checkup with Dr. G time, and we're talking with Dr. Michael Garber. That's the G and G. And Doctor, you are somewhat of a renegade in the medical field. You have established your very own independent practice for pediatrics. Why don't we step back and talk a little bit about how you got to this point?
Okay. Art, I trained in pediatrics at St. Louis Children's Hospital, and then thought that maybe I wanted to be a neonatologist. So I did a year at the University of Utah, and after that went back into general pediatrics, and from there moved to Montana. I've been here for about 16 years, and 12 of that in Great Falls, and 6 in my own practice.
Now, during that time, you had somewhat of an epiphany that you said, you know what, I think there's a better way to do things.
I think an epiphany is a great word to use, and one of the things that came to mind is that after training in pediatrics for a while, there's a certain level of care and there's certain things that families want. And so in providing your own practice and making your own decisions, that autonomy gives you the capability of being able to turn on a dime, to make decisions, and to bring innovation into the practice of medicine.
And that's what people are looking for today, Premier Care, and that's the name of your business.
That's right. And what we look at is that first is we look at what people want, and we try to implement those changes, and then we also set the bar and the standard, I think, within the community. And also we're always trying to develop new innovation and services that we bring not only to Great Falls but also to the surrounding communities.
And like you said, that's just one of the things that you can do as an independent is make those changes, turn on the dime, and give the people the care that they're looking for at the time they want it. I know one of the things that I hear a lot about your practice is that sometimes you will come in after hours. You will be there when the patient needs you to be there. Is that correct?
That's correct. And now that we have a nurse practitioner, Carlin Doyle, I'm able to work late in the evenings, and so what that does, and it's been something that I've thought was fun to do, is actually be able to provide families with well care and sick care after hours, and so they don't have to get off work, and it makes it convenient for them.
And you got to ask yourself why more physicians don't pay attention to what the consumer wants and needs rather than putting things into a box. And one of the things that I think you've done has been very innovative is when you walk in, you notice there's 2 separate areas to your walk-in office. Tell us about that.
Well, that was a very simple concept that we came up a long time ago, and basically the 2 things that we have is we try to separate the sick kids from the well kids, and it gives parents a sense that 1, we care, and 2, it also allows us to go ahead and make sure that children don't get sick when they come in for well visits.
Yeah, that just it just like makes sense. You know, it's like when you see other offices and you're wondering why aren't they doing that.
What you say is we just do things based on common sense and innovation.
So that's kind of what we're going to be talking about in our series with Dr. G. That we're going to be talking about how to take care of our children, what to be looking for, and just some of the innovations that you're bringing to the community as an independent. And we are at Premier Care Pediatrics, and that's our program for this week. Thank you, Doctor.
You're welcome.
You've been watching Checkup with Dr. G.